Have you felt exhausted in medicine? Like your practice is more like a treadmill than truly a calling? Is the charting weighing you down? Working well past your last patient of the day, charting at home, in the evenings and on weekends? The notes, paperwork, lab results, quality metrics, all the things, right? What if I told you there were some ways to make a change, to get more efficient, so you can finish work at work and have the margin to intentionally choose thoughts and actions consistent with your values and priorities? You can get my free guide with 10 tips for getting work done at work more efficiently. Get yours today at mededwell.com/efficiency. After that, if you know you want to take a deeper dive into your thoughts and clinical practice, check out MedEdWell Coaching with Dr. Stegink. Fight burnout and moral injury. Find fulfillment and create margin by examining your thoughts and actions to take that next step forward from where you are to where you want to be, aligning your actions with your priorities. To find out more and to book a consult, head over to mededwell.com/coaching. And now for the rest of today's episode. Welcome to the MedEdWell podcast, empowering physicians to get work done at work and then be able to reflect and choose what is important for both their life and medical practice. I'm your host, Dr. Ryan Stegink, general pediatrician and life coach for physicians. Welcome back to episode 37 of the MedEdWell podcast. Thank you so much for joining me. I'm so glad to have you here to talk about how we can take the next step in our wellness. In this case, we're in the middle of a 6-part series on charting and workflow optimization. Today, we'll be talking more about some of the workflow optimizations, particularly around communication, closed loop communication, and how that can make a difference for your patients and for how you experience your clinical workflows. I wanted to take a moment to thank you for all your support, for sharing these episodes, for listening, and for engaging, letting me know what you appreciated and what you'd like to hear about. So, one of the things that really struck me as I was thinking about this is how it's applicable in so many areas of life. I talked earlier about how the Thinking Leading to Action, episode 34, really had a big impact on me as I went through the past couple of months. One of the things was my family and I started looking at purchasing a home. The market's still very hot right now, and we met with a realtor, and he helped us understand what we needed to know about making offers in this market. As we went through the process, if we saw a home and we thought about it, we decided whether we were going to put in an offer, our realtor was really good about having us repeat back exactly what our thoughts were, what our offer was, and what the different parts of that looked like. We had to be crystal clear that what he was putting in for us and that we were going to sign reflected what we actually wanted. So, in a medical context, this closed loop communication has certain features, certain ways that it gets put into practice. Because if you think back to being a child and playing the telephone game where you tell a message to somebody else, they whisper it in the ear of someone else, and it goes from one person to the next, to the next, to the next. You don't know that you're going to get the same message back, and typically you don't. So when things really matter, having a shared understanding that's accurate is really important. So first, today, what is closed loop communication? It involves saying something, communicating something, and repeating it back. These things are now taught as part of the life support trainings with the communication skills section. It's also like teach back when you're giving patient education or summarizing the visit. It says, tell me what you heard, or teach me how to use that particular medication or device that we're prescribing for you. It may take a little bit longer, but it ensures that the message is properly received. Sometimes it exposes certain deficiencies that we may have in how we described it the first time. It may reflect that one or both parties in this conversation were distracted, or there was something else going on that made it more difficult to really engage or to hear it. Maybe it's that there's a different level of health literacy, or the terms that we're using are a little bit confusing. I've talked before about how on my developmental peds rotation, I used big medical words rather than really breaking it down into words that my families understood. So, first, what is closed loop communication? And secondly, who should you use it with? In what situations? Now, certainly there are those high risk situations, codes, giving medications, but there's also the routine things, vaccines, the particular dosage of a medication. Certainly there's some of the procedural things around entering orders, and that's part of why entering orders in a computer is required in most situations now, rather than just giving a verbal order. And it's definitely helped me because sometimes you're trying to calculate a weight-based dose of Tylenol for a febrile patient in clinic, and it's easy to think one thing. And I just talked to this other patient, the new patient that was just roomed is febrile, and trying to give things as opposed to saying, let me put that in the computer, and then you can see it, and then you can repeat back, oh, this is actually what it is. I've also encouraged my staff to talk back, to engage, to say, did you really mean to give that vaccine? Maybe I was looking at their chart and I thought that they were due for this, but no, actually the interval was too short, and so we actually need to wait on that. Or why did you give that extra meningitis shot to that 2-year-old? Well, actually that one's clinically indicated because they're traveling to somewhere in the world that has a higher incidence of meningitis, and it would be indicated to get that at the current time. So it's definitely, these questions have definitely saved me from making errors at times. And they've also provided opportunities to teach. I want my medical team to be empowered, but also to know why they're doing certain things. I want to understand that, to have that clinical reasoning, to use our minds in a way that reflects the training that we've received rather than just following protocol just because that's what it says. There might be an opportunity to deviate from that makes sense in the moment, but it's taking that time to say, this is what I'm thinking, this is what I want to do, and for someone to repeat back, this is what you're saying. Yes. All right, let's do it. It helps create a shared understanding of the situation, of the request that's being made. So, closed loop communication, when should you use it? But really, why does it matter? Well, for one, as we've been talking about, it matters for patient care, for reducing the amount of errors that are made, for helping teamwork and communication with workflows. particularly in situations where there is increased variability, where things sometimes are a little bit different. It helps promote safety and helping people feel like, hey, I can ask these questions rather than just, they're the doctor, so I have to do it. No, I want people to be able to engage and to really feel like they're supported when they want to check that they're understanding things. But it's also about supporting wellness, because providing good care that's more efficient, more empowering, that empowers the staff, my colleagues, myself, to be full human beings who get to have input in these situations, to feel heard. It really matters. So I want you to think about the thoughts that you've had around communicating with staff, with colleagues, consultants, feelings afterward. You may think of conflict that you've had in some of those situations. And the feelings might include being confused, being frustrated, feeling exhausted. Maybe you have something else that you feel when you think about communicating with others in a clinical context, maybe in a personal context. But what do you want to feel? After reflecting on these aspects of closed loop communication, how do you think that might be able to change? What's one new thought that you want to choose today to get that desired feeling? It might just help your patient outcomes, your patient satisfaction, and just how you engage with others and feel about your job. Thanks so much for joining me here on episode 37 of the MedEd Well podcast. I want to encourage you to subscribe, to share these episodes with another physician, to let me know how this has impacted your life and your clinical practice. Again, thanks so much for all that you do. Come back and join me on the next episode, and have a great day. And now for our important disclaimer. Dr. Ryan Stegink is a practicing general pediatrician, but the MedEd Well podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEd Well podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEd Well podcast, and have a great day.